What are the most common mistakes made using echocardiogram for screening of PAH?
Echo is a great tool when we start to suspect pulmonary hypertension in a patient, perhaps with dyspnea, or in screening certain populations. But there are clearly pitfalls to echo. One thing that everybody focuses on is what's that number? What's the estimated pulmonary artery systolic pressure? And that number is not always precise. It's reliant on a whole number of things. One is how much tricuspid regurgitation a patient has. And if you can't align your Doppler signal with the tricuspid regurgitation, or if a patient doesn't have enough tricuspid regurgitation, you may not get a good jet. You may not be able to estimate the velocity. Certainly, even when you have a jet, you can overestimate or underestimate that velocity. There can be a potential variation from the sonographer and from the interpreter. And whatever estimation you make of that velocity causes great changes in the estimated PA pressure, because using the Bernoulli equation, that velocity gets squared and then multiplied by 4 to get your estimated pulmonary artery pressure. So a small error in the velocity can turn into a large error in the estimated pulmonary artery systolic pressure. And we now have many studies showing that even half of the patients have estimates that are 15 millimeters or more off of what is measured at heart catheterization. So over-reliance on that pulmonary artery pressure is one error. I think the second error is not looking at the rest of the echo. We get so much information from the size and function of the right ventricle. So even if a patient doesn't have a high estimated pulmonary artery pressure, if the right ventricle is big and dysfunctional, I'm worried about them. So error number 2 is not paying enough attention to the right ventricle. And then perhaps the other error is not really looking at the rest of the left heart. So if the left atrium's big, or if the left ventricle is thick, or if there's mitral inflow suggestive of diastolic dysfunction, I'm worried about left heart issues. I'm worried about group 2 pulmonary hypertension. So you need to look at that also.